I'm going to share with some of the experience on genetics of glaucoma. That is one of the ongoing research project in my research laboratory. All of you ophthalmologists, I don't want to talk about glaucoma. The glaucoma is an optic neuropathy, and the concern with the reason for the formation of the glaucoma is maybe the rate of aqueous humor production by the ciliary body and resistance of the aqueous humor outflow across the Schiemann canal and the meshwork, and the level of the avascular vein pressure. In addition to that, the corneal thickness. So there is a myocillin gene identified by Dr. Stone and Walserfield group from University of Iowa in the year 1999 that Dr. Geraldo put a paper in his previous talk. So here the resistance for the aqueous outflow, in the sense there is a gene myocillin that is present in the chromosome number 1. So if the gene is mutated, so what it will do if nobody knows the function of the myocillin, but once the gene is mutated, the mutated protein, it will aggregate together and then form a extracellular matrix. Those protein, that the aqueous humor outflow, it will form a complex between the other normal and abnormal proteins. It will form a complex. Those extracellular matrix, it is blocked the meshwork. Because of the blockage, it increases the intraocular pressure and then affect the optic nerve, and then the people losing the peripheral vision, and they are getting the only in the central vision. So it means all the disease, if you take any disease, definitely there is a gene behind it. Concern with the glaucoma, we'll see in detail about the genetics now. Okay, so in 1999 they thought, there is, if you classify the disease maybe as only a single gene, single disease, they will call it with a particular gene causing a disease. So that is a single gene, single disease. But some of the disease is a complex disease like diabetic retinopathy and diabetes. So many genes involved, and then many the factors are involved associated with the disease. So here in 1999, as I told you, people thought about, it's only a single gene. But for the past 12 years, they identified more than 25 loci in the whole, because the human genome project is completed. They know the rough draft, and they identified 25 locus in the whole genome, and they identified only 3 genes, that is myocillin, optineurin, and then WDR36. These are for the primary open angle glaucoma or normal tension glaucoma. And there is another, for the congenital glaucoma, there is other candidate gene. And here, in addition to that, it's not only those 22 loci, some of the modifier gene or some other genes associated with the whole pathway. So these are the genes. I don't want to go in detail about the gene. If you see the complex here, so this is the whole complex thing, associated with the glaucoma. So that's what right now the glaucoma seems to be a complex disease. So this is a whole, each and every pathway, or in the pathology or the physiology of the disease, it is correlated with many things. So that candidate gene is very high, or some of the associated genes are involved in the glaucoma. Okay, so now if you see the concern of the genetics, if it is a congenital glaucoma, the candidate gene for this one is CYP1B1 gene, and L.V. Prasad Institute extensively studied this particular disease. And then if it is, we listed not only the glaucoma associated diseases like pseudo explosion and everything. So these are the genes. Suppose if it is, as I told you, is a myocillin, WD36, and then optineurin, OTLA, the OPA1. These are the genes which are associated with the open angle glaucoma. And the LOXL1, this is pseudo explosion glaucoma. So I will give you in detail about this thing. And this is the structure of the myocillin. So this is only 3 exons. So this is the exon 1 and 2, the mutation frequency is very low, but only in the exon 3 the mutation frequency is very high in the screening in all over the world. So suppose so far in myocillin, it means that if there is a mutation in the myocillin, and the chance is 5% of the glaucoma, primary open angle glaucoma patients having this particular mutation. So far 180 variants are identified, and among them 40% of them lethal. It is lethal in the sense it is associated with the disease. And these are I listed out all those 42 genes. These are related to the pathogenesis with the gene. And in our lab, So we extensively studied the glaucoma. So we analyzed the primary open angle glaucoma, 250 patients and the 300 normal controls. And we are using the molecular biology technique to identify the mutation. And we identified, these are the mutations. This is Indian our patients. So we identified around more than 8 mutations within the 250 samples. And then not only we are doing the correlation of the mutation alone, we are doing the gene expression studies, how that particular mutation is related to the disease. As I told you before, the extracellular matrix, once the gene is mutated, it will form the extracellular matrix, and then the matrix, it is formed the clumping, that is blocking the mesh work. So to prove that particular thing, there is a mutation called glycine 367 arginine. This particular mutation is one of the pathogenic mutation, because the patients is keep on coming to our hospital more than for 35 years, because the onset of the disease at 35, now he is around 70. So this is a very interesting case, and now we identified the particular mutation, and then we did the expression studies. And when we did the whole the screening of the family, so the elder brother, the patient is the elder brother, he is 65 to 70 years old. The younger brother, he is around only 25 years old. When we screen the whole family, that because this is a age related disease. The onset of the POEG, the classification of the POEG, the juvenile open angle glaucoma only 35 years, and then POEG is 40 years. So the younger brother is around 25, but when we screened, he got the same kind of mutation like the elder brother, and then we counsel the whole family, and the chance is very high. Why not to come and check up to the high hospital or check your pressure very often. So we educated the whole family, and you are prone to develop the disease. Take care of the eye pressure. So like that, we and then this particular mutation, this is when we identified. So all over the world, many in US and other places, we published together, and then so this particular mutation is a founder's effect. You can track where that particular the mutation is originated, like that. So this is one of the very good evidence to track the founder's effect. So we also got this kind of mutation in our population. And then this is the POAG. We identified all these mutations. As I told you, there are 3 candidate genes, and we also screened the optinurine. This is another candidate gene, but the frequency of the mutation is very, very low. And this is another gene. It is associated with the glaucoma. We screened, and then we identified the mutations. So it means we have a spectrum of gene mutations identified for Indian population. And we also analyzed the congenital glaucoma patients, and this is the gene, and we identified the gene, the mutations. And here you can see the arginine 368 histidine. This is one of the marker, and the L. Prasad Institute also working on this one. And it is a 10% of the congenital glaucoma patients definitely having this kind of mutation. It's already proved. And then in 2005 to 8, we have a multi-centric project between L. Prasad Institute, Aravind Hospital, Sankar Nethralaya, and All University of Medical Sciences. That time, because we want to make a DNA chip for diagnosis of the glaucoma, so we screened at least 150 samples per center. In Calcutta, Dr. Kunal Ray also screened this one, and the whole result is here. So we screened all the myocilin, all the 1,000 samples, and then this is the COP1B1 gene, this congenital glaucoma, and we screened this one for glaucoma. What is the relation between this particular gene and glaucoma in all the 1,000 samples? And then that is alone, the congenital glaucoma genes also we screened. So like that. So when we put all together all the results in the three centers, we are supposed to make a DNA chip for diagnosis, but we can't able to come up with the unique marker that is the population based. Suppose the frequency is very low, so that's what we can't able to identify the unique marker to identify the gene mutation within Indian population. And then this is another gene. This Dr. University of Connecticut, they identified gene, but the WDR36. So this is a very if this particular gene, the frequency of the mutation is only 5 to 6%, and this is not specifically for primary open angle glaucoma. This is there is a NTG, that is a normal tension glaucoma and primary open glaucoma candidate gene. This is the gene. And as I told you, this glaucoma, right now we are working on the pseudo-exfoliation. So pseudo-exfoliation, there is a mutation called G153 mutation. If this particular mutation is there for the patient, definitely they have 98% risk for pseudo-exfoliation. Even the same mutation is there in the control population also, and the risk for the control population is only 50%. So, because the sample size, we have plenty of sample size concerned with the pseudo-exfoliation, we grouped into pseudo-exfoliation alone, pseudo-exfoliation with the glaucoma and control samples. There are the candidate gene is LOXL1 very recently identified, and in addition the clusterin and the TNF alpha. So these are the other genes associated with the pseudo-exfoliation. So when we screened all these three SNPs, and it is highly significantly associated with the disease. And then if you go for diagnosis, so this is the current testing for recommendation. That's what Albert mentioned. So if it is the congenital glaucoma, if it is with the family history, we can go for this particular gene screening. And if it is the anterior segment thing with the family history, so maybe we can screen for the praxis and all those things. And here, if it is NTG, we can screen for optineurin. And then if it is a juvenile open angle glaucoma, obviously it is a myocillin. Dr. Edwin Stone group doing in the University of Iowa. And the POI onset before, this is 50 with the family history, the chance is very high for the myocillin. So like that. So this is the slide I would like to express. So this is the Corvus laboratory. So I think they are giving the anticipate what kind of exon they are targeting, and then how many exons. Not only for the glaucoma, the primary open glaucoma, they listed so many genes. So in our laboratory for the past 12 years, I'm working in Aravind, and we extensively studied more than 30 or 35 eye diseases. Now, concerned with the Indian scenario, we screened, at least we know the spectrum of a particular eye disease and the gene mutation. We have that kind of data, and some of them we generated a website for glaucoma, and then we given to Dr. Kunal Ray. He put them in separately for the Indian mutation database that is published in Nucleic Acid Research. So like that, now we have definitely for each eye disease, we know the spectrum of gene mutation related to the eye disease. And now, right now we are also doing that prenatal diagnosis for albinism, OCA, in our research laboratory. So right now the people are they are targeting only the DNA and then to identify the candidate gene. The primary open angle glaucoma is the mode of inheritance is autosomal dominant disease. So if we have the family history, like 3-generation family, 4-generation family, the chance is very high to identify the candidate gene. Dr. Stone, as I told you, in 1999, they have in the 3 or 4 generations family, they worked on and then identified the myocillin gene. So here, we are approaching in different way, like in addition to targeting with the DNA. So we are collecting obviously the aqueous humor during the tuberculotomy, and aqueous humor, serum and plasma. Sometimes we have the international eye bank, so we can able to differentiate between the glaucomatous eye, non-glaucomatous eye, and then take the meshwork from the glaucomatous and non-glaucomatous. Use those biological material, either it is a tissue or plasma serum or the aqueous humor. You can go for the proteomic analysis. Proteomic analysis in the sense, so you can separate the protein into the 2D gel electrophoresis, take that particular single band, and then you can compare with the glaucomatous and non-glaucomatous, or the diseased or the control, and then you can pick up the particular band and then put in the HPLC. Those things, it will convert into ions, and then you can see the pattern. So when you merge with the patients and the normal, you can make it, if it is a disease related, definitely you can make a spot, a separate spot that we can use as a marker, biomarkers. So biomarkers, like if it is the nephropathy, you already know about the nephropathy cases. So the onset of the microalbumins in the urine, before the onset of the disease, like within 10 years, before onset of the disease, it will come in the urine. So those biomarkers is a very sensitive technique. If you identify those things, definitely we can inform to to the patient, this is the biomarker for, or you are prone to develop for the nephropathy. So like that, so right now 25 loci identified for glaucoma, and only 3 candidate genes, and that's what we are approaching, a proteomic approach, not only for glaucoma. So we are targeting for diabetic retinopathy, fungal keratitis, and the CHED, congenital hereditary endothelial dystrophy. So we are using the cornea, and then we are checking the protein analysis. So like that, definitely, I mean, we are targeting to the biomarkers for primary open angle glaucoma. And I think maybe it'll take 2 minutes. And Dr. Balasubramaniam already, mentioned this one. The studying the genetic variation across the Indian population. And right now the human genome, like if you want to analyze your own genome, if you pay $5,000, I think the Chinese government slush the price. The Beijing Genome Institute, even within $1,000, we can able to identify screen the whole individual genome, like $1,000. So if you have your own genome, definitely we can able to say this what kind of the age related diseases, onset of the disease, what kind of disease you are going to prone for after the year 40 or 45. So we can able to see that kind of information. So that's what I would like to mention here. So this is my conclusion. So it means it's a complex disease, it's not a single disease. So people are working on different aspect to identify the candidate gene for primary open angle glaucoma. So and then the clinician, especially, I think we are, I will inform to my colleagues, I'm a mouth surgeon, I can't able to touch patients. So the clinician should give the proper diagnostic criteria. So that's what Dr. Jenny Wicks, she is having a collaboration with the Sankar Nethralaya. So they stringent the criteria. You pick up the right patient for the genetic studies. So if you stringent the criteria, the chance is very high to identify the candidate gene. So here, what I'm trying to say here, so the factors, there are so many factors associated with the disease. It means one of the factors is the family history. So if the 3 or 4 generation family of glaucoma, definitely that is the right family to identify the candidate gene for glaucoma. So I think we are going to tell some story within the near future about that. Thank you.